Right, so let's have a look at this case. I think this will be quite straightforward on this one, if I remember correctly. So let's download. And this person hurt their hand, and let's have a look. So I know, I bet you don't believe me, but I genuinely draw around every single bone, everything, at least my eyes. But because we're here, I'll do it with the pointer. So that looks okay. That looks okay. They look like a fairly youngest patient. These look okay. I draw around, decapitate, lunate, scaphoid, nothing there. These all look okay. Then I would genuinely draw around. I always pay very special attention to the fourth and fifth because that's often where you get fractures, especially the base. You've got to be very careful. I've definitely seen a few miss there. Can't really see anything. I mean, there's that linear thing there, but I don't think it's strong enough to say there's a fracture. The other telltale sign can be that you get soft tissue swelling within that sort of hand area. So if you've got soft tissue swelling like this and it kind of sticks out like that, then you are, okay, they've clearly got something going on. So you start taking a closer look. I don't think we've got anything like that going on here at all. We'll keep drawing around, nothing there. Draw around, nothing. All these look okay. Yeah, someone's got it. Well done. Yeah, terminal tufts are very important. Number of times terminal tufts have been missed. So just have a look. Sometimes people have crush injuries, soft tissue injuries. And I always tell people as well, just be careful with calling fractures of the terminal tufts as well, because if you see a radiolucency, see if it lines up with the nail bed. If it goes like this, then you're not looking at a fracture. Look, it does this. Sorry, I messed that up. Close that. If it does this, then it's not a fracture. But this is all looking okay, all looking okay. And then, yeah, so if we draw along here like this looks okay, doesn't it? And then we come across this way, this looks all right. But this is where it looks abnormal, doesn't it? Like this. And then it's kind of got this zigzaggy edge there, a bit of a zigzaggy edge there. But it doesn't look like, when you get fractures and they're really new, it'd be like a very well-defined, very obvious linear abnormality. So you have to wonder whether this is kind of slightly older fracture. So let's see if this is an older one. Let's zoom in. So yeah, it still looked quite, very fairly well put together. So this could be an older fracture, but in the context of injury, this could be the primary fracture. The only reason why I say it could be older as well is remember I was talking about soft tissue swelling. There's not much in the way of soft tissue swelling, and you'd expect like if someone's really cracked their thumb like that, they would have had a lot of soft tissue swelling. So they probably have a fracture, but I think we're seeing it a little bit later on than like in the acute phase. The acute phase would have this fracture and a lot of soft tissue swelling, but we don't have that. But we do have what looks like a fracture through the base of the terminal tuft of the thumb that has some articular surface involvement as well.